Today, health leaders calling on the community to help get the monkeypox outbreak under control. The North Carolina Department of Health and Human Services Secretary, as well as other public health leaders, actually making their way to Mecklenburg County this afternoon to visit vaccine clinics and get more insight on the virus here in our area. WCNC Charlotte's Jesse Pierre joining us live from North Charlotte with details on this visit. So Jesse, I have to imagine our case counts locally have to have some role in this decision to come to Mecklenburg for the visit.
Absolutely. Well, health leaders call Mecklenburg County the epicenter of the outbreak because that is where the majority of monkeypox cases in the state are reported. And they say that it will take a community effort to get the virus under control.
Now is not a time for anxiety, it's a time for action.
As of Monday, the Department of Health reported 95 cases of monkeypox in North Carolina, 60 of them in Mecklenburg County.
We want to get shots in arms just as quickly as possible for our highest risk individuals, and we want to do that equitably.
State health leaders coming together Monday to discuss the response efforts in the county. The virus, which is spread primarily through direct contact, continues to disproportionately impact the African American population and LGBTQ people.
The CDC actually just put out a report on this. We're seeing 99% of cases in men, of which 94% speak to some sort of sexual contact with men or other close contact. It's really important when you have a house on fire, fire department responds to that house first.
Mecklenburg Public Health Director Raynard Washington says the county received an additional 2,000 vaccine doses last week. And with a current wait list of 2,200 people, he expects to get through those doses by the end of the week.
We have increased our daily throughput so that we're able to vaccinate more people on a daily basis at the sites that we're vaccinating at. And continue to add several hundred people to the wait list every day. And so that as we take people off, people are added back in.
The demand is outpacing supply, but Washington says that more vaccines are on the way. Health leaders are encouraging people to get medical care if they do come in contact with someone infected or experience symptoms like fever, headache, rashes, or swollen lymph nodes.
Some of our key priorities are making sure that people know to get checked if they see signs or symptoms consistent with monkeypox. Make sure our providers are testing anyone that walks in with any symptoms consistent with monkeypox, and that we are making sure people are aware of the eligibility for vaccine and how to get vaccine. And
Now, the Department of Health also plans to hold roundtable discussions with local organizations and advocacy groups to make sure to get the message out there to community members so folks know, what to look for, how to get treated, and how to protect themselves. Live in North Charlotte, Jesse Pierre, WCNC Charlotte.